This week, we'll focus on acceptance and commitment therapy, or ACT, and here's the objective for today's lesson. The ACT model is part of the CBT spectrum of psychotherapy models and is sometimes referred to as a third wave model, wherein the first wave is behavior, the second is cognitive, and the third wave incorporates acceptance and mindfulness directly into the therapeutic realm. Note that the founder of this model is Stephen Hayes, who has referred to ACT as a values-based behavioral treatment. There are also powerful metaphors that I will discuss later in the video. Now here's a mind map of some of the concepts we will cover today. We'll use the same case review from last week, so please pause the video as needed in order to review Maria's background. Now, according to Stephen Hayes, acceptance and commitment therapy is a psychological intervention that uses modern behavioral psychology, including practices such as mindfulness and acceptance, at its core. The target is psychological flexibility, so we may think of concepts such as rolling with the punches or being able to better meet the challenges that life brings to us. Hayes added that clients are stuck, not broken or sick. Now there are three central constructs, namely accept, choose, and take action. These words nicely complete the acronym ACT. But there's definitely more to learn about this model. And the diagram of land, shelf, sea, and deep ocean is a good metaphor for the deeper concepts implied in ACT, which we'll cover at a basic level in this lesson. Accept is accepting what there is to be experienced. Choose means to make choices based upon your closely held values. Take action is to take charge of your life and engage in committed action that embodies your values. Let's simplify this and say it differently. With ACT, we need to show up, or choose, as we said earlier, let go, or accept, and get moving, which is the same as take action. Note that our acronym is now CAT, but hopefully you get the picture. Consider what these three aspects, show up, let go, and get moving, might look like for Maria. Using the example of letting go, this may involve helping Maria accept her diagnosis of bipolar disorder and her tendency to avoid uncomfortable feelings and situations. Now let's discuss the process of therapy according to ACT. Now this complicated diagram has been called the hexaflex, and though there are easier ways of explaining its contents, it may be helpful to use this model to demonstrate the 6 core therapeutic processes of ACT. As I said earlier, psychological flexibility is at the core, which is broken up into 3 sections: show up, let go, get moving, in the following way. The first part of the 3 is to show up, and part of this involves being present. Self in context implies that instead of thinking of ourselves as the center of the universe, one is instead an observer who, by being present, simply observes and just notices the world surrounding him or her, and also describes what is seen and participates fully without anxiously thinking about what may occur in the future. Consider Yalom's reflection on the therapeutic importance of being present with our clients, and pause the video as needed. Now, we just talked about the first process of ACT, showing up. The next involves letting go, which incorporates two parts: acceptance and cognitive diffusion, which is sometimes called diffusion. Note that acceptance involves allowing painful feelings to occur instead of avoiding them. If you think about it, it's often easier to avoid uncomfortable feelings than to face them head on. But according to ACT, we really want to focus on our feelings, no matter how painful they may be. The concept of mindfulness can help us do this, so let's look at mindfulness a little more closely. This quote from Romans provides a perfect example of mindfully focusing on God and renewing your mind in the process. Mindfulness can be defined as calm awareness of one's body functions, feelings, content of consciousness, or consciousness itself. Mindfulness is a form of meditation that can be practiced, and I encourage you to learn more about incorporating mindfulness into your life and into your therapeutic practice with clients. Let's return to the ACT process, and I'll now focus on the concept of cognitive diffusion, or stepping back and detaching yourself from your thoughts. One way of remembering this is to hold your thoughts lightly instead of clutching them tightly. This slide explains cognitive diffusion in a little more detail. Pause the video and read this page. If you thank your mind for having a thought, then you may be able to more effectively distance yourself from its content. By the same token, you are more cognitively fused if you think, "I am depressed," and more cognitively diffused when you think, "I am currently feeling sensations that are commonly labeled depression." When you're able to think that way, you are holding your thoughts lightly instead of clutching them tightly. How might cognitive diffusion be helpful for Maria? From the case study, Maria described herself as super irritable. Through cognitive diffusion, she may be able to modify her thinking and become less fused with it. Please watch the Stephen Hayes video on cognitive diffusion in order to understand the process better. Now, actually, the video is titled Cognitive Fusion, but it explains nicely the concept of diffusion in a therapeutic setting. Finally, the ACT therapy process moves from letting go to get moving, and this is where we utilize our values to achieve our goals, and then taking action to reach our goals. To get moving, ask yourself, what do you value most? And what gives worth and meaning to your life? Here's a list of core values. Which one stands out for you? When discussing values with a client, would you use a list such as this one to generate deeper conversation on this issue? What might be some of Maria's values? Her family? Financial stability? How could this discussion be a launch pad for emotional healing? Now, the next therapeutic step is taking committed and effective action, and the best action plan is a treatment plan. Now, because ACT is a form of cognitive behavioral therapy, a behaviorally based treatment plan can be very effective. The therapeutic tasks, for example, may be similar to those of cognitive behavioral therapy from last week's CBT treatment plan, as it applies to Maria. The interventions with Maria as the client will unfold in much the same way as we've discussed, starting with educating her to show up and learn to engage in the present moment. utilizing mindfulness and cognitive diffusion to let go of her depressive thinking, and helping her understand the importance of her values so she can create goals that are congruent with her values and get moving towards better functioning and emotional healing. Now, since the goals are mutually agreed upon by the client and therapist, it is hoped that the client will be committed to achieving goals both in and outside the therapy session. And one helpful thought before moving on. The central constructs and the process of the acceptance and commitment therapy model are one and the same, beginning with showing up, letting go, and don't forget to get moving. Let's now consider the goals and interventions of the model. Here's Stephen Hayes' definition of the main goal of ACT. Now, regarding ACT interventions, we've already discussed two: mindfulness and cognitive diffusion. Other techniques include the Serenity Prayer, in which we help the client learn to change what can be changed and accept what can't be changed. The finger trap metaphor to help clients understand that the solution is sometimes the opposite of what one would normally expect. Finger traps are very cheap, so consider buying a package of them from an online novelty store in order to help clients learn from this hands-on experience. Teaching clients to just notice their thoughts can help them become observers of their internal processes and thus more objective about them. And lastly, the box full of stuff metaphor, in which you can use a box full of papers, office items, etc. to symbolize the client's many thoughts and inner voices. Sometimes a trash can can be used and moved around the room as you tell the client, you are not what's inside this box. There's so much more to who you are. Now I want to talk about an important story from the Bible. Please pause the video and read the narrative about Mary's anointment of Christ. Think about how the concept of mindfulness could be applied to Mary's actions in this story, and we'll discuss this further in class. Now, one important final component as we look at the two models we've discussed over the past 2 weeks. Here's an easy way to differentiate between the two. CBT is principally about change, and as I said in the video, change comes through restructuring thinking and behavior. ACT is more about acceptance, and we use interventions such as mindfulness and cognitive diffusion to promote acceptance. How might we promote both change and acceptance in the work we do as therapists? Have a great week.